So welcome everybody. I'm Michael Ettlinger. I direct the Carsey School of Public Policy at the University of New Hampshire. We're here to talk with Jess Carson, also of the Carsey School, and Beth Mattingly of the Boston Fed, Federal Reserve Bank of Boston, about a new brief they just wrote, published jointly by the Carsey School and the Federal Reserve Bank of Boston. And so welcome, Jess and Beth. Beth is a former, much missed member of the Carsey School team as well. So it's nice to see you again, Beth, and it's great you guys did this brief. They're both highly accomplished sociologists. As I said, Jess is here at the Carsey School of Research, assistant professor, and Beth is, I botched it and good. Beth is the vice president, is an assistant vice president in the regional and community outreach department at the Boston Federal Reserve. I knew I had that somewhere. All right, on to business. So first of all, congratulations on what is really a timely and interesting brief. I think anybody who has young kids or knows anybody does or works with anybody who does knows that childcare has been, more and more of a challenge sort of over the years. Like it's harder now than it was when my kids were young. And, I just think everyone has kind of seen that. And certainly the COVID-19 crisis has really, elevated that and created a whole new set of challenges. I'd also say that, I think there are people who have not been focused on this issue as much in the past who are kind of waking up to it a little more because it's being recognized as, more of a challenge for the economy coming back, that with all these new challenges with childcare because of COVID, people don't have someone to take care of their kids or a way to have their kids taken care of. It's, very hard to go back to work. So I think you've really done a great job of kind of, painting that picture much more fully than I just did, of course, and sort of providing some new insight into it. I what I'd like to talk about, I sort of divided into 4 categories, like in our brief time, that I'd like to touch on. One is the extent and nature of the problem, both pre and post COVID, what's causing it, and what are the biggest challenges, coming out of the health crisis, and just, what do we know about ways to address those challenges? So if we could just start by, how big a problem is this? So I don't know who wants to raise their hand and pick that up, but Beth or Jess?
I'm looking at you, Jess. Do you want to kick us off?
Yeah. So, as you mentioned, Michael, access to childcare was a challenge before the pandemic, and this has only sort of made it worse. So, supply of childcare was always short. It was restricted for folks nationwide, but there are pockets of places where supply has been more constricted over time. So in rural places, supply is short. In some lower income neighborhoods, supply is short. We also know that the quality of childcare, when it's available, that differs too, as does the affordability of it. So thinking just about supply, it's hard to not also mention that there may or may not be supply available, but really whether there's a slot available or not, whether a family can access that slot is really contingent on whether they can afford that slot, whether it suits their family's schedule, et cetera. So supply is, even in itself, a complicated issue. As far as quantifying the supply challenges, it's hard because we don't have great measures that speak to sort of the length of wait lists or families' ideal care situations. A lot of times for a lot of families, they sort of grab up the care that they can get. And I think that's especially true now, that it may not, even in regular times, may not necessarily reflect what the real demand is either. And given the sort of shifts that we know are happening in workplaces, it can be even harder now to quantify demand than it ever was. So I think for me, I would say that quantifying both supply and demand challenges has always been hard, and it's especially complicated now. Beth, did you want to add to that?
Yeah, I'd add two things to that. One is that all of those things are true for parents who work standard work schedules. But when you throw in non-standard work hours, the constraints and the limitations are much, much worse. And through all of this, we need to keep in mind one thing that we see is that there are disparities. Jess talked a lot about income, but there are also racial and ethnic disparities in access even before the pandemic.
Mm-hmm. One thing I just, that you mentioned in the brief is you talked about access and implicitly but like there's the affordability and quality aspect of this too. So there might be, even if it's available, I mean, maybe you could address that.
Yeah, I think some of the work that Beth and I have done a few years ago looked at the cost constraints that families face, and that folks are spending much larger shares of their income than the federal government has deemed sort of affordable for families. So people are spending much larger shares of their income on care. That's not accounting for the fact that those burdens may be deeper for folks who have multiple kids, or like Beth said, who need care at non-standard hours, which, if available at all, tends to run at a higher price point. So certainly those sorts of affordability challenges were there before, but then as we talked about in our brief, Beth, there are a lot of pressures on the childcare system that are increasing costs to providers now, that we expect, in the absence of any other sort of intervention, that those costs may eventually be passed on to families, thereby driving up the affordability challenges in nature further.
I have a 4-year-old, and I recently said to her provider that she charges way too little and I pay way too much for what we get. And I think that's really the dilemma in a private pay market, right? That what an individual parent can afford doesn't cover the true cost of care. And we see this come on the backs of providers. And, childcare teachers are among our lowest paid workers, and they have high requirements for continuing education, for credentialing. And I bring this up now because this is inextricably tied to the quality of care that providers can offer.
I thought another thing that I hadn't thought about was also that, to the extent that people don't, go to institutional care, but are having families provide care, there's also this particular problem right now that, grandparents / parents who provide care are particularly at risk in COVID. So that kind of care becomes more problematic. So,
absolutely.
Yeah, I thought that was an interesting point. Just another thing, there was just one number that, like, it's right at the beginning of the brief about how 14% of workers are parents of a child under 6. And it just kind of highlighted, I mean, that's a big hunk of the workforce, right? And it kind of highlighted the challenges to the economy. I mean, obviously not all those people are sidelined by a lack of childcare, but even if a quarter of them are facing challenges, I mean, that's a big economic impact.
And Michael, that number is even bigger now as parents of young children who are school age face the reality that oftentimes they're doing a hybrid, only going to school a couple of days, or now parents have to manage remote schooling. So that's a lower bound in the pandemic.
Right. I know. It's like schools reopening is not a panacea even for older children, because, it's such it takes a lot of parental involvement. I mean, there was one, I'm not going to say which one because I'm not positive I have it right, but there was one city that when they went online in their school system, I think a quarter of the children never logged on, like, for the remote learning. It just shows you, like, it takes a lot of parental involvement. Yeah. So, okay. Maybe, I mean, to some extent, it's obvious, and you've touched on this a little bit, but I mean, if you could talk a little bit, I thought there was some really interesting stuff in here about the challenges like why these problems exist, right? And particularly, you both touched on this a little bit, but just, Beth in particular with the it costs too much to provide and it costs, I mean, like whatever, your point about they charge too much, charge too little point, which I thought was a nice way to put it. But just, what are the challenges that have existed for a long time for providers just being available? And what are those challenges? Like, why do we have this shortage? Because I know there was a number here, like 50% of people or something live in childcare deserts. Maybe you could sort of flesh that out a little more.
Yeah, I mean, it's a hard industry to succeed in because the costs are so high. There's not a lot of ways to cut costs, and it's highly regulated. There are a lot of compliance issues, a lot of regulatory issues, and so forth. I think, though, what we're seeing now with supply, because a lot of centers didn't have reserves, they didn't have a high profit margin. When they had to close, it's a real decision. Can they reopen? And as there are new restrictions and guidelines on how to provide care during a pandemic, it's not clear. I've talked to several providers who are open, but losing money providing care, that they're actually losing money by opening because of all the new rules.
I would agree with that. I mean, it's not like many other businesses in the sense that you can't sort of squeeze more out of your employees. You can't cut corners. I mean, they're so highly regulated, like Beth said, that it's not possible to drop a staff member from a center and retain the same number of enrolled children, because then you'd be in violation of the requirements around staff to student ratios, staff to child ratios. You can't cut costs the same way that you could in other industries. And with the pandemic, as we're seeing these kind of increased staff labor burdens around cleaning and around fewer children per group, or more space, or more distances between them, more materials, all of these costs are adding up at a time where profit margins were already so thin that it really just it's a mystery how many providers have been able to remain open right now. It just does not seem sustainable.
Yeah, I mean, you draw an interesting contrast with the public education system, which, like, whatever financial pressures they're under, public schools are not closing, in the sense of, so there will be supply of public education under whatever circumstances, they have to operate. You also, I think, there was some recognition there's been some recognition of this problem in Congress. I sort of alluded to the beginning that this is maybe more being recognized as an economic issue that affects everybody, just because it's a kind of a drag on the economy if people can't go back to work, let alone the industry itself being affected. So you do discuss what was in the CARES Act and what other kind of interventions have been proposed. Maybe you could just tell us what the status of that all is right now. Is it a funny status?
I mean, it's definitely not funny. I think that the status is really that things are kind of stalled right now, that there doesn't seem to be a lot that's moving forward. There's been some conversation, and folks are turning attention to, there are a lot of fires right now in the pandemic. There are a lot of things that are important to families, important to children that are happening, everything from rising insufficiency of food in households to racialized violence to the expiration of employment, supplemental employment, unemployment insurance. Like, all of these things are happening at once. So I don't think necessarily that childcare is unimportant, but it certainly hasn't risen to the top of the pile in terms of something that's moving forward really rapidly and kind of having a policy solution hustling through the legislation from my perspective.
Yeah, I mean, I definitely agree on the federal level with what Jess said. I think we are seeing some states really devote a lot of attention to this in their reopening plans. Maine is one. New Hampshire is doing a lot of thinking. I've heard many people say that, they're worried about childcare now, but they're really worried come January 1st when all of the CARES Act money will have been spent. And without any new allocations, that's when a more dire portrait emerges.
So what did the CARES Act do to help?
Well, some of this, there was some money specifically for childcare, but also some states have chosen to allocate some of their CARES Act funding that was more flexible to childcare. And also there were the PPP, the Payroll Protection Program, forgivable loans that some childcare centers applied for and received that could help them in the short term as well. Did I miss anything?
That's a good point. No, I think that's a good point, to not overlook the efforts that states and communities have kind of undertaken. I think, the states you mentioned are good examples. New Hampshire, for instance, has kind of worked hard to get their emergency childcare collaborative up and moving and kind of keep some systems open, particularly for the essential workers during the pandemic, and have kind of considered ways to best implement the balances of those funds and do it in ways that are in partnership with folks who are on the ground. So I think they've done a good job in doing that. But as far as the kind of federal big picture, broadly supportive legislation, that's been a little slower coming.
Yeah, to slightly digress, I was just sort of looking at things I'd underlined in your brief, and one thing I don't think you mentioned this, but in terms of the challenge, maybe you did, but the challenges that the centers are, the centers that were already on tight margins now, just, which the capacity issue is both centers, being able to stay open or reopen, but it's also that their just because of social distancing, capacity is smaller, which is both affects affordability, which is a point you make, and just affects the number of slots available. So,
yeah, and the other piece is that even centers that are reopening are often shaving off hours from the opening or closing time for cleaning protocols. So that's another way that it's being reduced.
Mm-hmm. Yeah, and I think we've seen, another expense for centers has been sort of trying to reconfigure the physical space to suit the changing demands and ratios and group size limitations. I know that's been both a practical struggle for folks, but of course also a financial strain for them as well.
Yeah, another point you make that I thought was interesting. I mean, there's not maybe not be an answer, but the fact that where people are going to need the care changes too, because a lot of people still be working at home. They still need childcare because they can't do their jobs with their kids underfoot, so whereas it used to be childcare was maybe somewhere in between work and home, it's way shifted now towards, wanting the care by your where you live, not where your office is. I thought that was another interesting thing. Let me ask you this, that actually related to that. It's a lot of the focus tends to be, they can't go to work because there's no one taking care of the kids. One anecdotal thing that I have heard from a number of people, and also just employees at University of New Hampshire, and is that challenge of working at home, of people, and it seems to disproportionately be women who are sort of being, saddled with this, but saddled is not the right word. But I mean, it's people are trying to work at home with their kids there. And even if there's someone ostensibly taking care of the kids, the doors get knocked on in the middle of the Zoom meeting. It's hard for people to get the work done if there isn't a separate physical location. So I don't know if that's something you've studied at all, but.
Are you talking about me, Michael?
No. Or me?
No, I have a 2 and 4-year-old, and that's right. I mean, even when, it's one thing to sort of have a parent at home. And I think maybe in other non-pandemic times when we're sort of conceptualizing and measuring what that looks like to have a demand for childcare, I think maybe that's a piece that we may not have thought through as fully, that having a parent at home is one thing, but they have to be a parent who doesn't also have a job. That, having flexibility and being able to work at home is not the same thing as not needing childcare. That, those needs are still there, even if you don't have to leave the house for one purpose or another.
And I think when the pandemic first hit and things were closed, everyone sort of scrambled and stretched and reached. And that happen both on the employer side and the employee side. But I think people aren't able to maintain that pace of constantly being on, tag team parenting nonstop. But I also don't want to lose sight that a lot of the essential workers who have to be there also need care and have major affordability constraints. And, if they relied on a parent of their own, the child's grandparent, to watch the child, and that might have been a no or low cost option, in order for us as a society to get the things we need, they need affordable care where they need it and when they need it.
Yeah, no, I'm glad you brought us back to that. Just the other thing, it's not about you, Jess. It's more actually, happened to be yesterday talking to a colleague here at the university who's in a supervisory position and has, 3 or 4 staff members who, as Beth has described, has sort of been, making it work, right? Taking care of their kids and doing their job. But there's, their paying job. And there's just, there's only so long you can kind of sustain that, right? So I think the point, I think it's definitely becoming a bigger issue for people. I think the way you described it is good, Beth. And then the essential worker point is, they're essential. We need these people in their jobs, and it's just like cobbling. You can only cobble stuff together for so long. So I think maybe I will close out by just kind of a combination question. We've highlighted a lot of challenges. I'm wondering if there might be things you think are sort of the biggest, highlight what you think are the biggest, barriers. Like if there were, I don't want to put you on the spot and say, what are the top 3 things you'd try to solve? But is it that there are childcare deserts? Is it or just even in the places that wouldn't have been deserts, like getting those places back online? What do you think are kind of the biggest priorities? And where do we go from here, right? Both to address the immediate thing of needing to provide childcare as we hopefully come out of the COVID crisis, but also longer term to rebuild the industry and kind of build it back in a way that it's actually, satisfying our societal needs in a way that it wasn't even doing before COVID. So that's a big question. Yeah,
I mean, I think the issue of childcare deserts is an important one, but it's hard to say that that's like the thing I would fix, because it doesn't matter if you're not in a childcare desert and you can't afford it, or it doesn't match your schedule. And it doesn't matter if you are in a childcare desert, but you have, a great family network nearby, or you have an in-house nanny, or, that people's resources and their family situations are so intertwined with their childcare needs that just a kind of blunt force measure of supply in their neighborhood or in their census tract, that's just not enough. It's not a good enough measure. And so I think, broadening access really to quality care that is more of an equalizer. Beth mentioned the challenges around racial and ethnic equity. We know from existing research that parents in majority Black or majority Hispanic neighborhoods are less likely to have access to childcare, period. But then when we intersect that with what we know about the occupational characteristics of Black and Hispanic workers, of the income characteristics of those families, that those barriers are just sort of building on top of each other and sort of funneling the access toward families who are higher income, who are white, who are in wealthier neighborhoods, and sort of making those disparities persist. So from my perspective, we can't really just address, the childcare supply issue without also addressing all of these other pieces at the same time.
Yeah, I agree.
The essential workers too, because So I'm sorry. Go ahead.
No, I absolutely agree, but I think fundamentally the structure of childcare, where it's individual parents paying for care for individual children, is for the most part. There are some public subsidies for low income and some tax credits, tax relief for moderate to higher income. But I think we really need a public investment in childcare. And saying, do we start with deserts? If we start with a public investment, and childcare is a public good, our economy needs it, our children need it, then that would take care of a lot of these problems.
I agree. I don't see any way around it other than that. I mean, I don't know how else you solve all of those issues without beginning, at least, with a massive public investment.
That's sort of the new public education. I mean, we know a lot more about the importance of early childhood education than when the current education system, was sort of public education system was developed, and and with women now participating in the economy, and important, and critical to the economy. It's we no longer have that sort of fallback for early childhood. It does seem like we need to adapt to the times, I guess. Anything else you want to add? So terrific brief. I commend it all to you to read. It's on the Carsey School website. I believe it's very prominent right now because it's our latest publication.
I think Christina had a quick question.
Oh, I'm sorry.
In the chat box there.
Oh, I didn't. I don't.
Oh, hi, Christina. I see it. She says there are a lot of estimates about the money needed to shore up the sector. Now we have an influx of school-aged kids into a sector that was already collapsing. How do we estimate the cost implications to meet this new need, both the scholarship money to the new population and then the unexpected expenses for parents who had children in school and didn't have care expenses before? What a good question, Christina.
Yeah, great question.
Yeah. Beth, do you have the answer to Christina's question?
I wish I could just pull one out and that it was that easy. I mean, I think Chris is asking the right questions that I'm thinking about. I know you're thinking about, Jess. I know lots of the other people we're talking to are thinking about. And I just want to highlight the one piece of this with the school age kids, that parents who weren't paying for care or were paying less for after school care are suddenly finding themselves scrambling to figure something out, whether it's, working longer hours so that they can take breaks to help their kids, hiring someone, finding alternate care arrangements for their kids, that families are bearing an additional expense in all likelihood, time or money, or often both. And that's something I just want to drive home.
Particularly because formal options don't even really exist for that popular. I mean, we don't have sort of all day childcare for school age children because we don't usually need that. So that's a very sort of unusual challenge that the pandemic has posed. And I do want to note too that Christina said, somewhere between $50 billion and $100 billion are the numbers being thrown around. That range is also what I've seen and kind of has been put forth by a variety of policymakers and experts. As far as pegging it down within there, I don't have the answer to that, but I think that range is about right. We're talking about a huge public investment.
One thing I will just point out, because I happen to be working with an economist on a piece he's doing in this space, that there's been a lot of very good research that when you provide high quality early childhood education to children, there's huge benefits to society and the economy over time, which actually go a long way to, in effect, paying it. You get more economic growth, which generates more tax revenue. So if you break yourself out of the looking at 1 year to, the short time frame, and looking at the benefits from, children doing better in school, contributing more to the economy, less likely to be in prison, it's like there's all these long-term benefits to quality early childhood education that have been pretty well documented and quantified. And so, yes, it's a big expense in the short term, but there's also a payoff if you look at it outside of the short term, which makes it genuinely less expensive than the sticker price. So I'll throw that in from my expertise. Any other thoughts? Do we have any more questions? Yes, thank you both for a great brief. That's a nice response. All right. Thank you both.
Thanks, Michael.
Thanks, Michael. Thanks, Jess.
Thanks.